Hey guys, my name is Angie Kingma. I'm so happy that you're here today and that you've decided to take this time to hang out together and explore the topic of mindfulness as it relates to coping with anxiety and stress and overwhelm. No matter who I talk to these days, I just always hear that people are so overwhelmed, stressed out, anxious, which is why I wanted to bring this topic to you, because I think that we're all feeling that from time to time. So just wanted to give you a bit of a background, some information on me, just in case you're wondering. I'm a registered psychotherapist and registered occupational therapist, OT, and I work in a variety of different settings. I have a private practice in Milton, Ontario, and I also work out of a hospital called Trillium Health Partners, Credit Valley site in Mississauga. And I work downtown Toronto at a non-profit called the Centre for Mindfulness Studies. So I've been teaching mindfulness for about 16 years now, and I provide mindfulness teaching, mindfulness-based therapy, and I'm working with clients to help learn to manage different skills for things like anxiety, depression, trauma, life transitions, chronic health conditions, chronic pain, and things that the doctors can't fix. And clients are told they just have to find a way to live with their symptoms. So I actually love talking about mindfulness just because I've seen firsthand how much it helps people with their quality of life and their empowerment, their confidence. And it's helped me personally so much. To tell you the truth, it's really been a game changer for me in terms of navigating those ups and downs of life, those curveballs that life throws at us, usually when we're least expecting it. And that's why I'm happy to share this information with you. So I really hope that the workshop today is going to offer some new suggestions for you, or at least reinforce the ones that you're already using, and then helping you to feel more adept, more efficient, and basically more confident to manage the symptoms of anxiety, stress, and overwhelm. So before we start, just wanted to mention that it might be helpful to get a piece of paper and a pen and have it there in front of you, just in case there's any nuggets that you find helpful and you just want to jot them down. And I'm also going to be offering some suggestions for you to reflect on your own patterns of how you typically experience anxiety and stress, and then make a proactive plan to cope in a different way going forward. So if you don't have the pen and paper in front of you, it might be a good time to pause the video and go and grab one. So today in the workshop, we're going to be covering a few different areas. The first area is about education about normal anxiety, different types of anxiety, when it tips over into a disorder, talking about some brain science behind anxiety and stress, because knowledge is power, and talking about a concept called the window of tolerance, which I absolutely love, and it's really helpful for managing anxiety and stress. Some of the other things we'll cover is coping skills, how to mindfully deal with those ups and downs of strong emotions. And we'll also go over some practices, like for example, the RAIN skill, which I'm happy to bring to you from one of my teachers, and learn how to actually feel anxiety effectively. And then the last thing that we'll cover is this sort of invitation to create an action plan of sorts. The therapeutic value of doing that is just to sort of increase your own mindful self-awareness, your insight into your past patterns and your habits. Although insight alone is highly overrated, so we'll also be making a plan on what to do differently to help you to re-regulate, rebalance, and get back into your window of tolerance. So I can't wait to tell you all about that. All right, so let's just take a mindful breath, just feeling your breath and feeling your body as we get started. So what is anxiety? Well, anxiety is a completely normal and natural emotion. We all feel it from time to time, no matter how old we are. And sometimes in our lives, we feel it a lot more than other times, depending on what's going on. And sometimes we actually get bombarded by stressors, and anxiety can feel completely overwhelming. So it really has a huge range of or degrees of seriousness, degrees of frequency. And it can actually come up in a lot of different forms. So some people feel anxiety symptoms when they have a specific challenge going on in their life. So it can be something extremely overwhelming. It can be maybe a new boss comes on the scene at work, or a new manager. I hear that a lot. Big relationship change, relationship stressors in general, huge losses that we go through. Can be something humiliating or embarrassing that happened. Other people feel anxiety when they have a sudden wave of a panic, like a panic attack, where they might feel like they have to run away from the situation. So maybe they're at a mall and out of the blue they have a panic attack, and then they associate the mall with those panic attacks and they decide they're never going back there. And then they become afraid of having another panic attack, which becomes something called panic disorder, where they just don't want to feel those uncomfortable sensations. Other people have a type of anxiety which is sort of social anxiety, where they get extremely self-conscious. They have a lot of nervous thoughts and worries about whether people are judging them harshly. They feel like people are going to think they're stupid or think they're an idiot. People are going to lose respect for them. There's another type of anxiety called health anxiety, where the mind is obsessing or perseverating on worries and thoughts about aches and pains, lumps and bumps in their bodies, fearing worst case scenario, thinking the big C, and making lots of trips to the doctor and asking for repeated tests over and over. Another type of anxiety is where people experience a variety of different topics, just a whole bunch of worries, which often come up in the mind as what if thoughts. They're fearing the future, they're assuming things are going to be turning out badly, feeling like they're not going to be able to handle anything, and then just questioning all these different possibilities and scenarios in their mind of things that will probably never happen, sort of like a generalized anxiety. Other people have anxiety which shows up as intrusive thoughts, really, really distressing, uncomfortable thoughts that sometimes they will come with a compulsion or a feeling like they have to do a repetitive behavior, like checking, counting, placing things just so. And if they don't do that, they feel really uncomfortable. They feel like something's just not right, which is sort of an OCD type anxiety. There's also phobias, like a specific phobia to dogs or snakes. There are also fears where people have had a past traumatic situation, and something in the present moment reminds them of that past trauma, and then they just get a huge wave of anxiety in the present moment, and it creates a feeling of danger happening, even though it's not happening in that moment, but it feels like it's happening. Their nervous system is reacting as though it's actually happening. So if someone's had a car accident, for example, and then they drive by the vicinity, they can have a huge wave of panic and anxiety, which is sort of a PTSD type experience. So it's not technically an anxiety disorder anymore, but it has a lot of features of anxiety. So these are just some of the common types of anxiety that people experience. Some people have a little bit of each of them. I do experience a lot of anxiety as well, particularly social type anxiety, and it's hard for me in social situations sometimes. I might get a wave of anxiety or worry thoughts, and doing this video actually has been kind of difficult to process the worry thoughts and feelings. And so I just decided to focus on the fact that I want to bring this information to you guys, and I worked through the anxiety and just decided to go for it. So the very interesting thing is that regardless of the original cause of the anxiety or the type of anxiety that you're experiencing, the coping skills are pretty much the same. So it's pretty fascinating that we're going to get to what those coping skills are in a little bit. But first we're going to practice a little mindful pause. So together, if you're willing, I'm going to invite you to take a couple of longer than usual breaths. You can do it with your eyes open or your eyes closed. And And just feel the physical sensations of your breath right now as your body is breathing in, your body's breathing out. So wherever you feel the breath most vividly, just begin to feel those sensations. And then feeling your body pressing down into the whatever surface you're on, the chair or the couch or the bed. And it's just good to do this throughout the day, a few times a day, and just help the nervous system to settle down a little bit. So a lot of people ask me, what are the causes of anxiety? What causes it? And it's pretty multifactorial. There's often a genetic component to it, but not always. It can happen due to traumatic situations, as I mentioned. Going through traumas can really activate the nervous system and anxiety. Too many stressors happening all at once can be overwhelming for the nervous system. Or one big, huge stressor that's happening can trigger acute anxiety. And, as human beings, we all have limits. We all have tolerances. And sometimes we're just pushed past our limit for coping. Another common factor these days is just multitasking. We have so much information overloading our nervous systems every day. We are bombarded by technology, social media, and one of the newer studies was saying that people are checking their phones an average of 80 times a day. That's about every 12 minutes or so people are checking their phone, and sometimes up to even 300 times a day. So it's a strong pull towards tuning out and feeling overwhelmed. One of my teachers was calling all of the social media outlets weapons of mass distraction, which is so true. We've never been more distracted as a society. And it's hard on our little nervous systems. So focusing our attention is becoming more and more difficult, and hence the need to train our mind in mindfulness. Another thing that contributes to anxiety is just not really taking good care of ourselves with the basics, like sleeping, drinking water, proper nutrition, eating balanced meals, getting physical activity. It's so important to help us cope. Misusing substances also can be difficult for the nervous system and really kind of negatively impact our emotional state. So when can normal worrying and anxiety tip over into an anxiety disorder? Well, these days, it really depends on how much the symptoms are interfering with your day-to-day functioning. So if you can't do what you would like to do or need to get done, that is factored into the diagnosis. Also, if it's really interfering with your ability to feel joy for a prolonged period, that's also factored in. And it's medical doctors and psychologists who do the actual diagnoses. And a lot of people also are intrigued, and myself included, into the science behind, what happens when we're feeling anxious or stressed. And the science is actually pretty compelling, and anxiety is actually a part of our built-in survival mechanism. So it turns out that as human beings, we were wired for survival and not happiness. Our anxiety is also known as the stress response. And from an evolutionary perspective, it was designed to help us survive actual dangers which threatened our life way back when. So in the caveman or cavewoman days, when the tiger would show up, this mechanism would kick in and stimulate the fear response so that we could handle that sort of situation at hand. And we could either fight or run away or feign death. So I'll explain the physiology in just a sec, but just wanted you to know that the fear response is, we need that. We can't get rid of that. We have to have that to help us alert to possible potential dangers. And I have a nickname for the part of our brain that's kind of scanning. It's like a smoke detector of sorts, and it's always scanning for smoke or possible threats or danger in our situation. And the name of the smoke detector I also have a cute nickname for, which is it's actually called the amygdala, or the nickname is Amy, because it's Amygdala. So Amy works very, very hard in our brain. We have two little almond-shaped amygdalas on either side of the brain. And she is always looking for those threats. And so if you're worried about a future situation that's coming up, for example, Amy might be fueling our anxiety for days or sometimes weeks on end. And then sometimes the situation turns out fine and we worried all that time for nothing. So I'm sure we can all relate to this idea where we get stressed out and then anxious and it goes totally fine. Amy can go off as well if we're thinking, I don't know if I can handle this situation. And then she would set off this fight, flight, or freeze response, and we start to feel anxious as a result. So it's kind of like if we were to use a metaphor of a car, it's like a car alarm that is being set too sensitively, and sometimes the wind can even set it off. When Amy does detect a real threat, our nervous system, the sympathetic nervous system, kicks into high gear and sets off a whole cascade of responses that are aimed to get us to get into action. And it's automatic and involuntary. We don't think about it, it just happens. So I'm going to put up a picture here of the fight, flight, or freeze response. It's from Psychology Tools. And when Amy or the amygdala does go off, it bathes our system with cortisol and adrenaline and norepinephrine. And our whole sympathetic nervous system starts to rev us up. Again, if we're using the car metaphor, it would be like the accelerator of the car. And you can see from this diagram here that it affects so many different parts of our bodily systems. And it creates a whole host of uncomfortable, very unpleasant sensations in the body. But they're not dangerous, although they feel dangerous sometimes. But these days, we're actually not in a jungle or on the Serengeti. Obviously, we are in more of like a concrete jungle. And modern day life, it's not the tiger that's looming to eat us. It's more of our thoughts that are creating these stress reactions and fight, flight, or freeze reactions going on throughout the day. And Amy is setting off these alarm bells a lot of times because our attention is getting pulled into the past or the future, and it's our thoughts that are creating all of this anxiety when there's no actual dangers or threats that are happening in that moment. So how does mindfulness help with this? Well, the mindfulness skills that you have or that you're building will help us to see more clearly when we're being pulled into a stress reaction, to see what's really happening. Where is our attention going? It helps us to slow down, even to slow down the reaction or the habits, and to make intentional choices about how to manage the uncomfortable sensations that are coming up, allow the fight or flight to come down, notice the storylines that are happening in our mind that might be stressing us out even more, and then skillfully bring our attention back to what's really happening in the present moment. So we can pour our attention, so to speak, into what's really happening and direct experience and getting out of our heads. Believe it or not, even when we're asleep, whether we're awake or we're asleep, Amy can be creating all these sort of vivid imaginary threats and fears, and we can rerun storylines from the past. We also hop into the future in our mind, and we kind of imagine all sorts of feared outcomes and possibilities in the whole world of projections and predictions. And one of the limits of being human is that we want to feel in control of what's going to happen. But when you look at it in more detail, we're actually not in control of very much. So that sets us up for anxiety, because we know the truth is that the future is uncertain, and we don't have a lot of control over it. So mindfulness helps us to calm those waves of thinking about the future or replaying the past. And when this is happening, it's almost like we're stuck in a movie theater in our head of these storylines from the past and the future that are playing over and over. And it's very frustrating because a lot of times people don't have the skill to get out of that loop of being stuck in our mind. And so mindfulness helps us to get out of that, and to anytime we see that we're doing that, we're ruminating, we can come back to our breath, just like we did earlier, feeling the body against whatever surface you're on. Anytime you're helping your attention to land back in reality, we are disengaging from that ruminative thinking. And so when it comes to dealing with anxiety and stress, it's best to think about it as triggers. Whenever we're managing it, it's like we want to deal with one trigger at a time, because anxiety shows up as triggers. It can be a person, it can be a feeling, it can be a situation that is causing the fight or flight to go off. And the triggers aren't just physical danger triggers, like if somebody's yelling at us or attacking us, or if you're hearing footsteps behind you in the parking garage. We also are wired to be social beings, and so sometimes there can be social threats that are coming up in our mind, where we're thinking that someone is not liking us, and we get a wave of anxiety. It's a hardwired response that we can learn to become more aware of. And the other thing is about when it comes to the future, we often instantly feel overwhelmed. We just have so many things to do, a million things to do, it seems like, and they're never done. We're never completely finished with our to-do list. It's easy to feel anxiety, like wondering if we're going to be able to cope with everything. So this is normal. It's important to know in terms of anxiety that it also shows up in our thinking, in that sometimes, with anxiety, our thinking actually gets a little bit twisted, so to speak. Some people will call it twisted thinking, or distorted thinking, or irrational thinking. Elisha also calls them negative unconscious thoughts, or nuts and UTSs. But whatever we call it, we know for sure that anxiety makes our mind have two specific errors or distortions, where we're not seeing reality clearly, we're mixing up the facts. The first type of distorted thought is where we over-exaggerate or we overestimate the likelihood of something bad happening. So again, it feels very real, but our mind is overestimating danger. The second error is where we underestimate our ability to cope. Our brains assume that, there's no way I'm going to be able to handle that, when in fact we would be able to. So these are both negative assumptions that we make that we don't necessarily know we're doing, but mindfulness can help us to see when we're making those errors and become aware of that, so that we can see it as just a thought, not necessarily a fact. And then we can try to focus more on facts and what we know for sure. That's a really great way of bringing our stress down, is just checking the facts. And also reminding yourself that our thoughts are not facts. The more you practice mindfulness, the more you realize that a lot of our thoughts are pretty unhelpful. So we can reframe our thinking too, using mindfulness to sort of think something a little bit more helpful. Remind yourself that you're capable and you are going to be able to cope. Or remind yourself that even if it doesn't turn out the way you want, this is going to help you to grow in strength and resilience, in wisdom. So our brains need these little reminders from time to time. So again, let's take a couple of breaths here, just feeling your body, feeling the breath sensations as we transition to the next section. So I'm so excited to bring this diagram to you. This is the window of tolerance that you'll see up here on your screen. I just love the visual. And the diagram here is, it's kind of a metaphor that it's been helpful for me, helpful for a lot of clients. And it just is a representation of the ups and downs that we go through with our nervous systems as we go through the demands of our day. So it's normal for our mood to fluctuate, kind of depending on what's happening in our day. It's not random. It happens because of whatever is happening in our causes and conditions, we call them. And sometimes a trigger will ramp us up into this state of hyper-arousal, which you'll see at the top, or will trigger us to kind of shut down into hypo-arousal. So we'll get to what these are in just a second. But first, if you can take a quick look at the middle part here where it says the window of tolerance, or the optimal zone. We're alert, we're engaged, we're calm, we can think about options clearly, we can problem solve, and we can make choices that are going to be helpful and responsive versus reactive. We're still moving with our day up and down. We're going to be going up and down, but we're really coping with the punches of life, so to speak. And so this is kind of where we're aiming to stay within that window. But you can see that it's also normal for us to get pushed up against our edges of our comfort zone or our window of tolerance. And a trigger can make us spike up into this state of hyperarousal. So in that state, we are not calm, we are distressed, we are feeling frazzled, we are feeling irritated, might feel like we're freaking out a little bit, we're very sort of angry sometimes, irritated. It's not uncommon for anxiety to turn into anger. So if you have that experience, it's very normal. When we're in hyperarousal, it's very hard to think clearly. We can't. A lot of times we're making poor decisions. It's just very habitual. Our muscles are tensing up through the body. Behavioral urges is to sort of repetitive behaviors like eating or nail biting or leaving the situation, avoiding something, numbing out with substances, tuning out on the internet, lashing out. So in this state, it can feel very out of control in a way. Sometimes it can feel pretty scary. So if you've gone outside your window of tolerance, you need to downregulate that reaction through using your mindfulness skills that are going to help us to recover and rebalance and bring us back down to that state of homeostasis. So some skills that you can use to downregulate, we'll put them up here on a slide here for you. But first of all, it's bringing mindfulness to the experience, so tuning into what's happening versus tuning out. We're going to cover the rain skill in a couple of minutes. Grounding yourself, cold water on the face, cold water on the inside of your wrist, opening to your senses, getting present with your hearing, smelling, feeling, tasting, touching. Releasing the tension in your body, lowering your shoulders, softening the bracing, as Elisha talks about. Standing tall, feeling your feet on the floor, actually tapping your feet on the floor. Bringing your attention away from the story and just kind of, as best you can, getting into your body, getting as present as you can. Sometimes you need to move. Walking around, going outside can be really helpful. If you can, nature can be really helpful. Or just even calming yourself through saying, breathing in, I calm my mind, breathing out, I calm my body. And then it's always helpful in that state to use self-compassion too, because it's a difficult experience. And self-compassion helps to downregulate the nervous system as well. So the other state that a lot of us will fall into is hypoarousal, where we just are beginning to shut down. Like we feel a little bit maybe spacey, a little bit lowered mood or depressed mood. We feel very tired, extremely tired, like we're going through quicksand. Our motivation basically tanks. We have no motivation. We feel zoned out, feel numb, disconnected. You might want to go to bed and just shut down. And if you've gone into this part of the window of tolerance, the hypoarousal, again, there's skills that we can use to help us to re-regulate and upregulate back into the window. So we're going to put some skills up here for you to have to follow along with. But number one is mindfulness, always tuning into what's happening, taking a closer look. The rain skill, which we're going to talk about in a second. And when we're in hypoarousal, activities can be really helpful in terms of pleasurable activities, mastery activities, giving a sense of accomplishment, doing something productive, going for a walk, doing something social, maybe texting somebody, reaching out. And we don't wait till you feel like doing them. You just gently force yourself, opposite action, maybe put it into your schedule so you get started. And then you can even use just day-to-day activities as focusing your full attention on the activity to help you bring the energy up. Deep mindful breathing can be really helpful too, just to help you to open to the experience and accept what's happening. Mindful self-compassion is also really helpful in hypoarousal. So either way, the mindfulness skills can help us to re-regulate and just to be aware of those fluctuations. Sometimes they're huge fluctuations. And then once we're aware, then we can respond a little bit more wisely and more skillfully. And then when we are in the window of tolerance and we're coping with things pretty well, mindfulness helps us to really savor that and appreciate and be grateful for those times as well. So take another breath here and just feeling your breath as we kind of transition to our next section. Again, you can do it with your eyes open or your eyes closed and feeling your body here. So I'm going to introduce the RAIN skill to you. This is a skill that I had to share with you because it's been helpful for me personally and for a lot of clients. And it takes practice, but it's talked about by a lot of different mindfulness teachers. But it was first coined by one of my teachers, Michelle McDonald, who works out of Vipassana, Hawaii. 20 years ago, she actually coined this. So whenever you're feeling a strong emotion, whether it's hyper or hypoarousal of anxiety, it starts with really being aware of what's happening. And the RAIN technique helps us to do that. So the R stands for recognize. Just recognize what's really going on. It's impossible to deal with an emotion and be resilient with it if we don't acknowledge that it's actually here. So naming it, noticing what's here. For example, maybe you're feeling uncomfortable about an upcoming thing. Maybe you're feeling overwhelmed with your thinking of your to-do list, or you're anxious about a conversation that you are going to have or you just had. So just naming what it is. Anxiety is arising, or I'm feeling overwhelmed. The emotion of overwhelm is here. And then A for RAIN is allow. So allow the experience to be exactly as it is. Don't try to change it or fix it. Just accept that it's here, no matter how unpleasant, no matter how intense it is. And pretty much giving yourself permission to feel what you're feeling, because it's here anyways. So we just stop trying to push it away. We stop trying to block it or get rid of it. I is to investigate. So investigate the experience with an attitude of kindness, with a deep sense of curiosity and openness, not with a spirit of problem solving so much, but more just getting clarity about what this is like. A lot of times emotions are always felt through the body, actually. So finding where in your body does it feel most predominant. Clenching in the chest, tightness in the jaw, tension around your eyes. You're exploring the sensation so that the emotion feels a little less solid and unmoving and a bit more tolerable. Feeling the ebb and flow of the sensations through your body as you breathe with them and investigate them. So the last step of RAIN is non-identification. The N stands for this ability to not identify with the experience or the emotion or the thoughts, and reminding yourself that it's not you as a person, it's you're having this emotion, you're observing this emotion. It is not you, it is just passing through. Maybe even thinking about it like a storm passing through. There are causes and conditions that are causing these thoughts and feelings, but it's not who you are. And sometimes the metaphor of the sky and clouds can be helpful, that you are the awareness, you're the sky, and the emotions are the clouds that are passing through. They might be dark clouds, but you can observe them from a distance. So those ever-changing weather patterns are not taken so personally. It doesn't have to threaten who you are as a person, so you're not identifying. And that's the RAIN skill, and I find that it's extremely helpful for strong anxiety or overwhelm. If you're in hyper-arousal, you might want to first bring it down a little bit through breathing, deep, calm breathing, or through cold or ice, and then try the RAIN afterwards. So once again, just taking a moment to connect with your breath, and just maybe even stretching if you feel like that would be helpful as we go into the next section. So the last section here is about changing a relationship to anxiety in general. And specifically being willing to have it, because anxiety is there again designed to help us to survive actual threats and dangers, and so we can't get rid of it altogether. So it's really more about changing our relationship to it and getting more comfortable with actually feeling it. So we make an active choice to not struggle with it and not push back, not block it, not distract from it, but turn towards it. because there's evidence that shows that if we do block it, if we do try to push it away, it actually persists and lasts longer and causes more distress and more dysregulation, which is interesting. So we are just practicing turning towards anxiety and overwhelm when it shows up, since it's there anyways, sort of learning how to befriend it and to calm within it. We're retraining our gut to not to suppress or intellectualize it, but just to sort of work wisely with it. When it does show up, validate that. Just say, it makes sense. It's okay to feel this. I can breathe with this. And it really helps to do that. If you have any self-critical thoughts, replace those with self-kindness and self-compassion. Remembering that you are not your anxiety. And then also choosing to participate in your life, in your valued activities. Don't let anxiety stop you from doing what you want to do. In fact, let it help you to move towards what you want to do. And take care of yourself, take care of your vulnerabilities, help you get back to your window of tolerance with proper sleep, proper hydration, eating in balanced ways, getting physical activity. Those are all really important to help us to stay within the window of tolerance more often. Being mindful throughout the day is very helpful. Like, this is informal practice of mindfulness. Grounding your attention many times a day as you can, even just a couple of times or even once a day, but pouring your attention into these everyday activities, like if you're pumping gas or you're standing in line, you're folding laundry, you're having a conversation, you're eating a snack, drinking a coffee. Bring your attention to that and really pay attention. And anytime your mind is spinning into the future or the past, just kind of bring your attention back to your breath. Also choosing to decrease multitasking. We know that it actually is more overwhelming for our cognition and our memory, so just try to do one thing at a time. One mindfully is the skill that we're trying to practice more of the time. Another thing that we can do is just feel that mindful breathing. Anytime you're avoiding a situation because of anxiety, just mindfulness helps you to see the avoidance and just turn towards it, letting yourself feel the discomfort, facing situations so that we're not avoiding and reinforcing that anxiety. And it's really helpful just to sort of use the anxiety as a motivator to sort of practice those skills, skillful living, and see when you're turning away from something. Bring compassion to yourself when you're having a difficult and anxious moment and let go of those judgments. Meditating regularly, 5 or 10 minutes a day, even just some of the days, trains your attention, helps you to feel more focused, builds concentration and insight, self-awareness, and then the last thing is to practice mindful self-compassion as much as you can. Hands over the heart. It's a gesture to indicate to your mind and your body and your heart that you're taking care of yourself in that moment. It doesn't have to be, it can just be 1 second. It is not easy to feel anxious or overwhelmed, and so the appropriate response to pain is compassion. So it's not just a nice idea, but it actually, there's a lot of science behind it too. It decreases cortisol, it increases oxytocin, those feel-good hormones that our bodies all make. And this brings us to the end. I'm so thankful that you guys took this time here today. I have to wrap it up. There's a worksheet that we're going to be placing up on the screen. Think about creating your own action plan where you list your old habits, your old reactive ways of feeling anxious and your thinking and feeling and behaviors, and list the new mindfulness skills or the old mindfulness skills that you're going to be using to help you to down-regulate if you're in hyper or up-regulate if you're in hypo-arousal. Thanks again, guys, for spending this time with me. I'm grateful. You guys are awesome. I hope that this nourishes you in some way, shape, or form, helps you feel a sense of peace, clarity, confidence, stability, or any other takeaways from the workshop. Hopefully it benefits you and those around you in as many ways as possible. Thanks a lot. Bye for now.